Picture this. It's 2 in the morning, and you're awake again, padding to the bathroom for the 3rd time tonight. You stand there waiting, the stream weak and unsatisfying, that nagging feeling like your bladder isn't completely empty. This scenario is playing out in millions of bedrooms across America right now, and if you're over 50, you know exactly what I'm talking about. This isn't just about inconvenience, it's about how an enlarged prostate, medically known as BPH or benign prostatic hyperplasia, hijacks your entire quality of life. You start planning your day around bathroom locations, avoiding long meetings, and turning down social invitations. The fear creeps in. Will this keep getting worse? And what can you actually do about it that doesn't involve medication or surgery? Before we dive deeper, let me introduce myself. I'm Dr. Isabel Lopez, and I specialize in men's health, particularly helping men navigate these challenges with evidence-based approaches. I want to hear from you right now. Comment below and tell me what city you're watching from. Seeing our community spread across the country reminds me why this work matters so much, so please follow the channel. Here's what most men don't realize. What you eat can significantly influence your urinary symptoms, and I'm going to prove it to you today. We're going to count down the 4 worst fruits that could be making your nights more miserable, then reveal the 4 best fruits that could help you sleep through the night again. But first, we need to understand why this problem affects your entire life, not just your bathroom habits. When you're constantly worried about finding a bathroom, you stop living fully, you avoid theater shows, long car trips, and even intimate moments become stressful. The ripple effects touch every aspect of your life. Your work performance suffers when you're tired from interrupted sleep, your relationships strain when you're irritable from exhaustion. Your confidence erodes when you feel like your body is betraying you in the most basic ways. The progressive nature of BPH symptoms creates a psychological burden that's often overlooked by medical professionals. You find yourself mentally mapping every restaurant's restroom location, declining invitations to events where bathroom access might be limited. This isn't just about physical discomfort. It's about the gradual shrinking of your world as you accommodate an increasingly demanding bladder. Today, I'm going to show you how strategic food choices can be your secret weapon against these symptoms. We'll work through a countdown format. First, the 4 fruits you should limit or avoid completely because they are secretly sabotaging your progress. Then, we'll reveal the 4 powerhouse fruits you should consume daily to support your urinary health and potentially reduce those nighttime interruptions. Before we continue, I need you to understand this is educational content designed to complement, not replace, professional medical care. If you're experiencing blood in your urine, fever, or severe pain, stop watching and contact your urologist immediately. Now, let's explore how the right nutritional choices might help you reclaim your nights and your confidence, starting with the scientific foundation behind these recommendations. The recommendations I'm sharing today aren't based on internet trends or wishful thinking. They are grounded in solid research from respected institutions. The American Urological Association guidelines acknowledge the role of lifestyle modifications in managing BPH symptoms. The National Institutes of Health Office of Dietary Supplements has published extensive reviews on how specific nutrients affect prostate health and urinary function. Recent studies published in the American Journal of Clinical Nutrition, Nutrients, and the Journal of Clinical Endocrinology and Metabolism have identified specific dietary patterns that correlate with reduced BPH symptoms. These aren't miracle cures, but they represent evidence-based approaches that can complement your existing treatment plan. The research consistently shows that certain foods can either worsen inflammation and urinary urgency or help reduce these symptoms. Stick with me until the end of this video because I'm going to give you a practical 7-day checklist that you can print out and follow immediately. This isn't about perfection. It's about making informed daily decisions that accumulate into meaningful improvements over time. Food is medicine, but it works gradually, requiring consistency rather than dramatic overhauls. What makes this approach particularly valuable is that these dietary changes benefit your overall health while specifically targeting urinary symptoms. We're not just addressing prostate health in isolation. We're supporting your cardiovascular system, managing blood sugar, and reducing systemic inflammation. These interconnected benefits mean you're likely to notice improvements in energy, mood, and general well-being as your urinary symptoms improve, setting the stage for understanding which specific fruits are working against you. Let's start with number 4, canned peaches and fruits packed in syrup. These are sugar bombs that create inflammatory spikes throughout your body. The added sugars trigger glycemic roller coasters that promote weight gain around your midsection, putting additional pressure on your already stressed prostate. Instead of reaching for that convenient can, choose fresh peaches or frozen varieties without added sugar. Or if you must buy canned, select those packed in water or their own juice. Number 3 might surprise you, grapes and raisins, especially when consumed in large portions or late in the day. Fresh grapes contain concentrated fructose that can worsen urinary urgency, while raisins are essentially nature's candy with sugar levels comparable to soft drinks. The worst part is how easy it is to overeat these. 1 cup of raisins contains the sugar equivalent of multiple pieces of fresh fruit, overwhelming your system right when you need stability most. Number 2 is watermelon, consumed in typical American portions. While refreshing, its high water content combined with natural sugars creates a perfect storm for nighttime bathroom trips. That massive wedge at the summer barbecue might taste great, but it's setting you up for a miserable night. Limit yourself to 1 cup of cubed watermelon earlier in the day, and pair it with protein or fiber to slow sugar absorption. The number 1 worst offender is fruit juice of any kind. Even 100% natural juice strips away the beneficial fiber while concentrating all the sugars that irritate your bladder. Orange juice, apple juice, cranberry juice. They all deliver too much sugar too quickly, creating the exact glycemic spikes that worsen BPH symptoms. Replace these liquid calories with whole fruits and water with lemon, and watch how much better you feel. But the real game changers are the 4 fruits I'm about to reveal. Join the Members Club. Drop a super like if this information is helping you understand your body better. Now let's talk about the 4 fruits that could transform your nights. Number 4 is tomato, which is technically a fruit and rich in lycopene, a powerful compound that supports prostate health. The key is consuming cooked tomatoes in soups, sauces, or sautéed dishes, because heat makes lycopene more bioavailable to your body. Number 3 includes citrus fruits like oranges, lemons, and limes, packed with vitamin C and antioxidants that reduce inflammation throughout your urinary system. These fruits provide excellent hydration without the sugar overload of other options, but be cautious with grapefruit if you take heart, blood pressure, or cholesterol medications. Aim for 1 serving daily, preferably earlier in the day to avoid nighttime urgency. Number 2 encompasses all berries, blueberries, strawberries, raspberries, and blackberries, which deliver powerful anthocyanins with minimal sugar impact. These antioxidant powerhouses fight inflammation while satisfying your sweet tooth without triggering urinary symptoms. Fresh or frozen without added sugar both work perfectly, and you should aim for about 1 cup daily, mixed into yogurt, oatmeal, or eaten plain. The number 1 best fruit is pomegranate, loaded with polyphenols that multiple studies suggest may improve urinary comfort and help stabilize PSA levels in some men. You can consume the areoles directly in salads or yogurt, or drink 100% pomegranate juice without added sugars. Half a cup of areoles or half a cup of pure juice daily provides therapeutic levels of these beneficial compounds. But remember to implement all these changes gradually while monitoring how your body responds over the next few weeks.